And we're back at it with hematological pathologies. Polycythemia vera, not kind of an antiquated term. Now the expression is erythrocytosis, and this is a condition where there's too many red blood cells. That means the solid component of the blood is too great. We talked about hematocrit. Getting too low. If it gets too high, the blood is sludge-like, and this can a primary case of this is from stem cell disorders. Secondary would be putting the body in positions of needing or in circumstances or stress to the point of needing more oxygen carrying capacity. Examples of that are listed for you here. Altitude training. Why do endurance people train at altitude? Because they're going to produce more red blood cells. People who smoke put themselves in a position to not have enough red blood cells to carry oxygen because there are changes in their cardiorespiratory system. And so each red blood cell is less effective, and so they put themselves, because they're inhaling carbon monoxide, they need more red blood cells to get the job done, because carbon monoxide overrides oxygen, and there's not as much oxygen being carried per unit of red blood cells. And then chronic conditions of heart and lung disorders. That makes sense to you. They have low volume of oxygen carrying capacity because of their disease. Well, the body produces more erythrocytes and hemoglobin. There it is. What are they vulnerable to? Well, they're vulnerable to myocardial infarctions. They're vulnerable to avascular necrosis or hypoxia, and the incumbent symptoms and diseases of that. So they're vulnerable to infarctions. Infarctions happen all over the body. We tend to think of it in the heart, or and it happens in tissues that we'll cover through the rest of the semester. How's that? Signs and symptoms of erythrocytosis: too many red blood cells, headache, malignant blood pressure, meaning worsening, hand aesthesia, so paresthesia, anesthesia, peripheral circulation is not good because there's reduced blood flow, redness, erythema, irritability, low back pain, and pruritus. Treatment is to take blood away from them. It's still practiced where leeches are put on people to draw blood from them. Now, that's pretty antiquated. That goes back thousands of years where that was done. Somebody got sick and they did, in quotes, let blood. Not used very much anymore because there's more sterile means by which to do that. So, okay. And then, how about too many white blood cells, leukocytosis? This would be, there's an increased number of white blood cells. What causes leukocytosis? Appendicitis? Bacterial infection? You can think. The white blood cells have to fight the disease, and so that's diagnosis for certain kinds of diseases. If you have a whole bunch of white blood cells, then that's a secondary way of saying there's a disease process. Let me come back here and make a point here. Hang our hat on too many white blood cells greater than 10K. If you're greater than 10K and you have right lower quadrant abdominal pain, that person has appendicitis. Now, white blood cells in excess of 50K, this is leukemia, right? Over 10,000 would be indicative of something like a neoplastic disease or pneumonia or bacterial infection or appendicitis, over 50,000, you can imagine the body is just jammed with white blood cells, elbowing out the red blood cells. And then, when do we get low levels of white blood cells? When, in people who have systemic lupus, they're alcohol abusers, there's a nutritional deficiency, or there's splenomegaly. The splenomegaly cause this? Yeah, because there's white blood cells that are produced there. Splenomegaly because the body's turned on this cell production of more white blood cells. Okay? Yeah, and so low white blood cell count, high blood cell count. Hope that makes sense to you. And then thrombocytes are necessary blood constituents to cause us to clot when we hemorrhage, either superficial or under the skin with the skin closed. Thrombocytosis. Too many of these thrombocytes are caused by myeloproliferative disease, meaning that the marrow is diseased and producing too many. The signs and symptoms of these are headache, because there's big pressure, and levator reticularis, and I've given you a picture of this characteristic skin, patchy skin, that there it is. It's there for you as the health care practitioner to recognize that if you see this kind of leopard type skin, then this is what's going on. And then hand and foot aesthesias, paresthesia, anesthesia, or hyperesthesia. And the pathology that we're worried about are thrombi that could become emboli. And then if we don't have enough thrombus, then we're going to have hemorrhages. And so etiology of this is leukemia, metastatic cancer, and chemotherapy. Too little coagulation of blood can lead to nosebleeds, petechiae and purpura. Please know the difference. Purpura is a big purple spot. Petechiae are small spots of focal bleeds. Okay, subcutaneous, and but you can see through the skin where these bleeds are. And then dark, black, smelly stool. Melena, it's pronounced. Hematuria, blood in the urine, excessive menses, and gingival bleeding, which is bleeding from the gums. These people brush their teeth. They don't have enough thrombi to stop they've got a little irritation and they're going to bleed. It's way important for you to know that aspirin negatively impacts the production of thrombocytes. It causes suppresses platelet aggregation for 48 hours after taking one round of aspirin or anti-inflammatory disease. So people who are taking too much aspirin don't stop their bleeding appropriately. Need to take that into account. We'll talk about that more coming up. And then sickle cell disease. This is an inherited disease when parents have the trait, and it can be passed to their offspring. It's inherited. Red blood cells, when oxygen is extracted off of the red blood cell, it tends to happen as a result of stresses, triggers that get this offset. But what happens is that's a normal red blood cell, and when oxygen is extracted from it, it changes its shape, and it gets caught in the tubing of the vascular system, and these don't reshape, so they have thrombi, and this can be life-threatening, or can lose a particular organ. Yeah, and so triggers include infections, dehydration, hypoxia, where you're low on oxygen, and as a result of altitude or exercise, extreme temperature, or emotional disturbance. Sickle cell disease signs and symptoms are listed for you here: pallor, irritation, hand-foot syndrome, where there's ischemic pain and swelling, cerebral vascular accidents or strokes, acute chest syndrome, pneumonia, and pulmonary infarction. So tissues die in the lungs. The prognosis is just not way good. If it's a runaway case, this can be life-threatening. And then we finish with sickle cell trait. This is not a full-blown sickle cell disease process, but the person is way vulnerable to hypoxia. There was a visiting football player, I can't remember the team, NFL player, who, because he was playing at altitude, it's hypoxic, it triggered a sickle cell crisis. He was in a critical condition, and he lost his spleen and a kidney as a result of this, and so he doesn't play there anymore. This year, this happened 2 seasons ago, his team went back to Denver. He's not going to play, just because we know that's a trigger. So anyway, be students of the hematology system and its pathology. God bless you. Bye-bye.